Good morning. Sir, I'll let everyone in.
Yeah. Actually, you can mute others.
Yes, sir.
You can touch on the screen. So to mute everybody at the entry, you
Yes.
go on your Zoom and you mute everybody at the entry, and you can
Unmute. Yes.
Today, we will talk about the laser physics, tissue interaction, and safety consideration. My name is Dana York. I'm a professor.
Excuse me, ma'am. Excuse me, ma'am. We will give you an introduction because you need a lot of introduction. You have got such a great accomplishments. So I'll be personally introducing you before starting off with the session. So we are waiting for other participants to join, and once they join, then we'll start off this session.
Wonderful.
Ashwini, are we waiting for some more to join?
Yes, three more. I'll just we'll wait for 2 minutes and.
Yeah, we'll start. We'll not keep ma'am waiting for the
Okay, sure, sir. Sure, sir. So we'll start.
Yeah, we have got
Okay. Good evening, everyone. This is Dr. Ashwini, welcoming you all on the behalf of Asian Academy of Laser Therapy. Today, I feel this privilege to have two esteemed people on my panel, Dr. Madhu Hariharan sir, the academic head ALT, and Dr. Professor Dana York, all the way from New York. I hand over it to Madhu sir.
Good evening, everyone. I should say good morning to Dr. Dana York. And before I start, I just have to tell you a few of her accomplishments, because if I start speaking about her achievements or awards, what she have got, I may have to take the entire session to keep speaking about it. She's such a great, wonderful person as such, and also a laser enthusiast. So a few of her accomplishments I'll be enlisting. She is the president of European Medical Laser Association since 2001. She's the clinical assistant professor at New York University. She has completed a master's of science in biophysics and cellular technology from Bucharest. She's got doctorate in biomodulation in periodontal regeneration. She's a distinguished professor at various other institutions across the world, and she is also a professor at Trivandrum PMS Dental College, as well as a visiting professor. So today's session on laser physics, tissue interactions, and safety consideration is one thing what you need to know about lasers, and you are learning it from the right person. And once again, privilege. ALT is also privilege, and thank you all for coming in, and welcome you all to the event. And all to you, ma'am, Dr. Dana York.
Thank you, Dr. Hariharan, for such a wonderful introduction. We will talk today about the laser mechanisms and how that interact with the tissues. let me show you this lovely team, Patricia Longo and Leonardo Longo, my mother and father of profession. I am the child of Laser Florence. You see here Florence, Italy, and Emla found it in Switzerland, then got a home in Laser Florence. And the president and his wife, Patricia Longo, they put together all the laser therapy speakers from the world, and we met there and we enjoy the lasers therapy and all the other lasers in medicine, and we made friends and we learned. Unfortunately, Mariano Postiglione is no longer with us, peace to his soul. And here I was, a young doctor coming to Florence. I became a member of EMLA in 1996. They made wonderful sacrifice, and I am the product of Laser Florence. Thank you so much. Then a few years later, we wrote this encyclopedia, Laser in Medicine and Practice. This here in the corner, you will see, back in the corner, you will see Santa Apollonia, the Saint Apollonia, which is the saint protector of barbers, surgeons, and dentists, because in the 1600s, it was only one. Laser therapy. We have the device. We use it. It's a medical device, laser therapy. Now let me explain. Every single year we go to Kovalam Beach, to Goa, to French Riviera. We go to Long Island here in New York, Southampton, or to Brazil. And whenever we have a little bit of money, we go in a holiday. And why do we go there? Because it's good for you. Because going to see the sun, bathing in the sun is good for you. So that's what we choose to do in holiday, to recuperate our batteries, to regenerate our forces.
Sorry to interrupt, doctor. Can you be a little louder?
How is the sun?
Good.
Professor Longo and Leonardo Longo and Patricia Longo, they're the mother and father of European Medical Laser Association. I have the honor to become the president recently. I love them so much. I am the product of Laser Florence. In 2007, we wrote this book. Every year we come to laser to the light. Every year we take holiday, either to Kovalam Beach, to French Riviera, to Brazil, or to Long Island, or to the Brooklyn Beach. That is the world best kept secret beach. So why we come to the beach every single year? Because it's good for us. We get regenerated. We recharge our batteries. So then we have this laser device. What is this laser device? Let me explain. Let's see the light of the sun. We go to the beach to sit in the sun. And let's see the light of the laser. So the light of the sun is not organized and have all the colors. The light of the laser, depending on which laser it is organized and striped. It have a spot size and it is organized. This is the laser handpiece and this is the laser device over here. This laser is a diode, but we have many lasers. Also, we have unorganized, non-coherent. Unorganized is non-coherent, monochromatic LED light, which also causes laser therapy. So when we go back to the sun, what is then laser therapy? Is the light of the sun without the side effects of staying in the sun and having the not wanting laser lights. I hope everybody's hearing me okay. Please confirm. Thank you. Now, what we're gonna do now about this laser light? What is the laser? Light amplification, stimulation, emission of irradiation. So when we have this amplification of light with the laser, what we have? We have stimulation and inhibition. So from the laser therapy, we get regeneration and we get pain relief. This is the curve of effect of the laser. This is the curve of effect of the laser. When we put it on wherever we want to apply it, we have this dose and this effect. And because this is infrared, we then don't see the light. We don't see the light. And the effect is at a distance from the handpiece, and it's a cold effect. What are the clinical effects? Inflammation, tissue repair, analgesia, bone recovery. Which parts of the clinic we have this laser? Where we use it in the hospital? Everywhere, in all the area of the hospital, we can use laser therapy. Now, over the years, laser therapy got all kinds of names depending where it was used, in Brazil, in North America, in Asia, or in Europe. So each of those names goes to the same thing: photobiomodulation, laser therapy, cold laser therapy, soft laser. Why cold? Because it doesn't have heat. Why soft? Because it's a low frequency. And there it is. Who proposed this phenomenon of stimulation emission of irradiation? Einstein in 1960. And what happened to him? He left Germany because as a Jewish person, he was about to get killed over there. And he went to Princeton, he went to New York, and then he went to Princeton. What did he do? So he found that if it is one electron with a higher energy and another jet of electrons with another energy, when they meet, they cause particle of light. He called them photons. Photons. And that is irradiation. And then between two photons, it is a distance which is called the wavelength, the wave of emission of irradiation. And that's how we measure laser. Now we compare again light of a bulb, which is unorganized, and light of the laser. Light of the laser is coherent, straight and direct like an arrow, and the light of polychromatic is from the bulb or the sun. Let's see in the spectrum of light where we see the lasers. We have many devices that were built and invented over the years. And we look at the wavelength. 100 nanometers all the way to 10,000 nanometers. Now for laser therapy, we are in the region of visible and infrared. So visible is only between 400 and 750 nanometers. And then infrared is after that. But what we discover is that infrared have this non-invasive effect inside, non-invasive effect at the distance. So for that, we can use it at the distance, and is an efficient treatment. We can use it on the heart, we can use it on the bronchi, on the respiratory system at the distance. So we can touch and make a treatment on the bone without cutting. Now, what is the laser absorption? The laser hopefully is getting absorbed, and hopefully the laser light does not reflect, hopefully does not scatter or is not transmitted, and let's hope for that. So what we want is we want to have absorption in the tissue. Who invented the laser? This is only 40 years after Einstein theory. Theodor Neumann, another nice Jewish boy, and he made the first working laser. And then 2 years after him, Professor Isaac Kaplan from South Africa took the laser from his body from a factory, and he put it into the oral maxillofacial surgery. First, he did some tests on few dogs, and then he put it on oral maxillofacial surgery. I met him, this is me, I met him many times. I asked him for a life advice. He said, take good care of yourself. That was his life advice. Take good care of yourself, because if you take care of yourself, then you're capable to take care of the others. Now, this week, we cry and we mourn the loss of Dr. Abraham Baruchin. Peace to his soul. He died this week. He left a lovely, wonderful son and family. His son is a gynecologist in Jerusalem, and Baruchin was for a long time Isaac Kaplan's boss. I remind you that Isaac Kaplan invented the lasers in medicine. He had the courage. I also asked him, what do you think about laser hair removal? And he said, get a blade. Laser is for serious stuff. I played piano for him. And every time at each conference he came, he spoke in poetry. In Tel Aviv, he moved from South Africa to Tel Aviv, and they named the University of Tel Aviv after him. He was praised and loved, and his wife also died, the mother of lasers in medicine, and died about 3 years ago. His apprentice, we are all his apprentice, but his apprentice, Professor M. Guyan from Thailand, make us cry at all time when he tells the stories from when he was a student. And then they were doing parties and Shabbat, and he grew up in Jerusalem in the practice of Isaac Kaplan. Those are some lasers, CO2 laser that was invented in Bell Lab, and Dr. Patel was working on it at that time. Isaac Kaplan worked with this laser, and these are several equipments that Isaac Kaplan worked with. What is that? Is that a crazy equipment that will be bad? And some people were suspicious, and they were thinking that this is bad for you and will cause cancer, and they wanted to prove it. So there it was, Professor Menster from Budapest. I I'm very grateful to him because he discovered laser biostimulation. So what he wanted to prove that laser is very bad and cause cancer. So he did 2 groups of mice. He shaved the hair, he took blood tests, and then he did low irradiation to one group. And then what did he found? That the mice is irradiated got better biological constants, and that their work is better, that they are nicer biological constants, the runes healed. So he's the father of biostimulation. But he wasn't scientist, he was a clinician, a doctor. Until the 80s, we did not have the proof of mechanism. And we say thank you to Tina Karu from Research Institute from Russia, who discovered the basis of scientific of cell retardation and cell activation with the laser and with the curve, Arms-Schulz curve, how it happens, this biostimulation and this inhibition. Also, he put for each laser in the spectrum how the hemoglobin is activated, the water, the melatonin. Here we are, another book edited by Emla. This is Laser Florence, and this is a group of researchers out in my heart at all times. Laser Florence, as I told you, we met her for the very first time, and everybody was talking about laser therapy. Laser therapy. So for that, we learned from each other, diabetologist, urologist, cardiologist, neuroscientist, periodontal surgeon, and so on. So we learned to get back into our practices and do as art, as then doctors. Now, first phototherapy association meeting. I want to mention Dr. Glenn Calderhart, which is a fantastic lecturer, Mary Dyson, wonderful lecturer, and again, to cry for the loss of Samuel Locke. Now, the new generation of researchers, and some of them, they are father and daughter, father and son, and it's wonderful. It's wonderful. Like Professor Longo have a son, Diego, who follows in his step. I am the daughter of the laser family. And then we have, I will show you later, other wonderful young doctors. So we have here a lovely group of laser therapy monsters, genius. You see Sharon Rao and Krishna Rao. Me and Krishna Rao in 2002, we were invited at North Atlantic Laser Therapy Association in Brazil at Guarujá, and we were both chairwomen because they thought Krishna is a woman. Chairwomen Krishna Rao and Tehina. Now Penny Smiley came and spoke to absolutely all the conferences and all around the world about safety and lasers. And then let me present to you Dr. Renita, Indonesian doctor from Jakarta, that she heart bigger than the world, and her father, Dr. Hassan, passed away some time ago. So we present also Professor Nguyen from Thailand, and I told you about him being the student of Isaac Kaplan, and he wanted to show me Tokyo when I went there. And as a young, impressionable doctor, I was afraid for a man to show me anything, so I didn't go. And I told him, and I told you now, the only regret I have in life that I didn't go with Professor Nguyen to visit Tokyo with his eyes. Then I found out that he's the son of Isaac Kaplan, and that as two Jewish people would meet in Tokyo, he wanted to show me around, but I didn't go. I went with my buddies, a Brazilian doctor and an Egyptian doctor. Now in this lovely picture, I present a genius of neuroscientist, Professor Kao from Taiwan, and all the others in these pictures are just wonderful, wonderful geniuses of laser therapy. Here we meet in Asia Pacific meeting Professor Bascu, who took my country of birth, Romania, into science of laser, because from the Institute of Science from Bucharest, his best friend Leonardo Longo, they made an enormous laser meeting, and I was about 19 years old when I went to the first one. It was called Romopto, and it was at the big palace in Bucharest, and that's where I got invited to go to Laser Florence and then to United States. Another amazing figure of medicine is Toshi Oshiro. Professor Toshi Oshiro got a clinic on top of a subway station in Tokyo, and he invited me. I gave him a pink silk suitcase when I arrived, and his son ran the clinic as well. And I told him in the book where you write that I want to be like him when I grow up. These are my students, our lovely students in Kerala. My first Kerala introduction, my first Indian introduction was in Indore for International Academy for Laser in Medicine and Surgery. And then I got a wonderful welcome both in Indore and in Kerala. I don't even start to tell you how much I enjoy to come to India. God bless India. Namaskaram. This is me in my practice receiving Dr. Taha, the chairman of PMS College, in my practice, and writing the diplomas, because at that time we did the course online at a distance. And this is me with our university, Kerala University PMS College, going to a competition where I lost in Dubai. How would I win? This is me as a researcher presenting a poster presentation with mercury and laser therapy. And this is my competitor, a doctor, a lovely doctor, and this was the commission. So, shame I lost, but I won. So much experience. These are other lasers in the world. Lovely, wonderful devices. Now, what happened? It is one mirror here, electrons going that way, lower energy load going that way, and cost is light. And depending on the wavelength, we have the color of the light or no color, infrared light, because many of the races we don't see. This is a solid state laser, and then we have electric state. So we have solid state crystal lasers, gas, helium neon laser, and electric, right? Why doctors will not buy lasers? Because they think it's too expensive, learning curve is too steep, it's not safe, it's not better than traditional treatments. They cannot be farther than the truth. Once you have the laser therapy device, become free, and you can use it for years to come. And imagine the pills, ibuprofen pills, Tylenol, anti-inflammatory, NSAIDs pills, They're expensive, right? Antibiotics are expensive. So laser therapy, it's like a physiotherapy, and it acts in immediate effect and in long-term effect. And laser therapy replaces those expensive pills. But is this laser like a weapon? No, the laser is very controlled as a device. Have light that is striped, coherent, uniform, collimated, and monochromatic. It's very controlled as a device. If it is a hot laser that burns, depends on the exposure, we have thermal damage. So for that reason, we can do the eye surgery, the dermatological surgery, surgery on the heart, on all the ways the lasers can be used in surgery. In laser therapy, is not hot. So there it is, thanks to door, we have some equipment, but we have other equipments that are not at all expensive, that are all around the world. And these are desktop, portable, and then we have the hand pieces, single laser, and then we have also the LED, which is an unorganized laser therapy with light. Now, you see the light of the laser, you touch the tissue and penetrates the tissue, and depending on depth, deep is the penetration, then we know how to use it. For example, the laser therapy, the therapy with a diode infrared can go even to 600 millimeters, 6 centimeters inside the tissue. For that reason, we can heal the bronchi, the lungs, the heart, the temporomandibular joint articulation, the knee, and so on. We see in the spectrum of light, I put here in handwriting the two wavelengths that I use in most of my clinical studies done, 630 nanometers and 830 nanometers. And most of the time, I combine them. So I use 630 for superficial on the gum, and then 830 for depth into the bone. And you see in the spectrum of light of absorption how hemoglobin have peaks of absorptions. And for the infrared is 910, and for the red 630. So in our clinic, we studied the gum and we arrived that the laser kills bacteria. In all cases, we found in the benefit of use the laser. Also, we found in periodontal disease that the laser treated patients. What does that mean, LLLT? Low level laser therapy. Why it's called low level? Because the power is little. 1 joule you need to cause this biostimulation and inhibition, and to cause this regeneration of tissue. In all cases, we found the normalization of the tissue using laser. Now, how that happened? So first you have the cell, and in the cell we have the nucleus, the ATP, and then we have this action that happened from the light, which is cytochrome C oxidase. This is the first effect. And then from the cytochrome C oxidase, it gets a signal to calcium pump and secretion of growth factor and activation of enzymes. That goes to the tertial effect. So that comes that in the cell, it's opening the natrium, potassium pumps and oxygen pumps of the cell to cause this serotonin circulation nerve conduction, and that leads to the soldier of the body, interleukin 1, interleukin 6, tumor necrosis factor, to get activated. Also, we get activated C fibers that cause analgesia, and protein C reactive that resolve inflammation. And then we have neutrophils and macrophages, and all together to cause this tissue repair. Also, from this signaling in the cell and causing oxygen, we get axon nerve regeneration. So let's recapitulate from the nucleus to C oxidase to electron transport into mitochondria, into cell, and into the tissues. Primary effect, ATP regulation and redox modulation. Cell signaling, what are the mechanisms? Tissue repair, inflammation, analgesia, their immediate clinical benefits and long-term. So how do we use? What is the method? We have local. Oh, I have pain in the temporomandibular joint. Quick, I apply to temporomandibular joint. And then what do I do next? I do local treatment and general, scanning the entire area. And then we have trigger points. And then we have an effect at the distance. So the effects, please read all by yourself. Enzymatic activity, cellular growth, collagen. Now I give you an example that is right in front of you. All my life, I used the laser on the patients, and I was courageous, and I did treatments, whatever I thought would be best. So that's how we discovered this bone regeneration in 1996 at the Center of Periodontology in Bucharest. I wasn't yet a master student. I was the student of Professor Agafița Lefter. And she gave me the laser in the hand to use it on the gums. And then we use it because we wanted to stop bleeding. And as we stopped bleeding, that was wonderful. And then how did she find out all that? She went and visited her aunt in the hospital. She had diabetes, and she treated with the laser some pain, and her gums reduce inflammation at a distance, not locally. And then we treated with the laser, we treated with all the patients possible. We were patient and we treated. What I was supposed to do, I was 19 and dental student, so I was her little slave over there. And wherever she asked me to put the laser, for example, for the apex of the tooth or that, I put it to remove pain, because at that time we knew about the short-term effects, pain relief, stop bleeding, and anti-inflammatory. But after a while, what did we see? We see that on the apex of a tooth that was damaged and had the periapical lesion, we see bone regeneration. And then we have all this mobility, periodontal mobility, and using the laser, we see bone fixation, ligament fixation, periost fixation. And from that, we looked on the X-ray and we found the better density and the better everything. So we arrived to the conclusion that the regeneration happens on soft tissue as much as on hard tissue, on bone and on periost. Of course, all these effects, so much research is still to be done. So much work is still to be done. But as much as we can, we do. publish, we do clinical studies and see what happened. Those effects, joules per centimeter square. But Mary Dyson's she comes from Yorkshire. She speaks beautiful English and she's a wonderful researcher. So he said, it's not patient what we talk about laser therapy. Is not laser, it's phaser, patient amplification, stimulation, irradiation, because we have skin, tissues, veins, arteries, the hydration of the skin, a bone. So to calculate the dose, we have to use in the database, in the literature, and to make our own protocols as well. For example, one guy that is just an amazing researcher, and we don't talk about him much, we should, is Nogier, who described the use of pulse. And he found that in continue, we do this immediate reduction of pain, inhibition, and in pulse, we do this amazing stimulation. And we use two frequency of Nogier, 4.92 and 9.12, and we are very in hertz, we measure that. We are very grateful to him. Let's talk about laser safety. Can we do like this? Is this working? Is this working? No, because if it's infrared, we don't see the light, and if we put it on the retina, can cause harm to the retina. Do we put it on the thyroid of the patient? No, because we don't know what effect can cause, and what if he already have hyperthyroid and cause biostimulation and cause a hypothyroid. We see the patient with the eyes like that. And we don't put it on the belly of the pregnant lady. Why? Because we don't know what it does. Is this laser something that is really scary? No. The device, we have to measure a wavelength, we have to put the right dose, we have to think of the content of the skin, and then we have to have goggles. So each wavelength have goggles. So this one, let me look. So this is a BTL infrared handpiece, 400 milliwatts maximum, and it is 830 nanometer. So then we make sure we put the goggles, and on the side of the goggles is a sign of which wavelength is useful. So it is between 400 and 10,000 and so on. This is the sign on the handpiece. You see, this is the sign on the handpiece. That's the sign, attention, is a laser in the room. And the same sign is outside of the practice with a pair of goggles outside. So if somebody enter in the room, they will put the glasses on to protect their beautiful eyes. You see, I have 100% good vision, even if I use the laser for my past 32 years of my life. So it's not this terrible sign on at the door, it's this sign. And we also see it says aperture 3B, the type of laser that it is. Aperture 3B. Oh, we see on the unit we have this laser, visible, invisible. Of laser is radiation and the dosage. The dosage. This is a sign for class 4. Laser therapy is used in class 3B. Let's look what type of classes of lasers we have. We have class 1, very low power, used in barcodes at the supermarket. We have class 2, also very low power, used for pointers pen. We have class 3R, which is used for laser printers, and we have class 3B, which is used for laser therapy, infrared light and red light. And then we have class 4, which is emitted for surgery hard laser that cuts. And then we have the industry lasers that come from the class 4 as well, and from all kinds of other. Laser therapy got published in over now 1 million publication journals, and a long time ago it was so disputed, and we are so happy that now it's not a controversial therapy, even if it's so new. We will talk about procedures. In the University of Australia, we have this approval of neck pain proved. Anti-inflammatory was made as a clinical study by my university. We see how bleeding, depending on the status of health of the patient, because when we look at the patient, we don't look only at the clinical concern that the patient came with. For example, we got this temporomandibular joint. We look also at the status of health, or we have bleedings from the gums. So we look, why this bleeding come? Maybe it have diabetes toxicity from liver and kidney, osteoporosis, or is a healthy patient with other local mechanical or iatrogenic problems that happen too. In all cases, we found that the bleeding stopped with use of the laser, immediate stop of the bleeding. Even if the patient is younger or is more mature, pain relief. For the pain relief, we use patient journal for the pain relief. We don't use anti-pain medication except in the control group where we had to use some anti-pain medication. How is happened analgesia? The laser therapy, PhotoBioModulation stimulates the C fibers that goes to give the axon response to pain relief. Analgesia, there is a study, 630 nanometers induce fast axon flow to cause this dorsal ganglion. For that, we have this spinal cord treatment because it's at a distance. So we have effect here. Pain relief, also we found in the benefit of the patient, of the status of health. The wavelength, remember again the wavelength. As the photon goes, that's how we measure the light, with the wavelength. So again, I remind you of the spectrum of light. We have visible, red, blue, and infrared. For photobiomodulation, we use red and infrared. And the best of all that gets this effect at a distance is the infrared because it stimulates inside the body. How we measure the dose? Because for a long time it was not credible as a procedure because of the measuring of the dose. And now after millions of papers, we got measured the dose. Intensity of power in diagonal to cause the dose measurements. So we put it here, but we have the effect as it goes deep into the system. So we get stimulation, inhibition. Stimulation, inhibition. It's used for mucositis, for temporomandibular joint, and it's used as a replacement of anti-inflammatory pills. One other thing I want to tell you, as safety, in the practice, don't have shiny surfaces. All the surfaces in the practice where the laser is used have to be non-shiny. So when we talk about the laser, you saw in the clinical research that we made that laser is a pain relief. And what do we know? Another pain relief, we know the NSAIDs. So what are the NSAIDs? Ibuprofen, Tylenol, Advil, and they do remove pain. It's true, very effective, but they have side effects. What are the side effects? Inhibit tendon to bone healing. Ibuprofen, it causes nervous system, immunity system damage after 3 months of use. And also risk of heart failure. Also, the anti-inflammatory pills are the 5th biggest killer in the United States, and is also cause erectile dysfunction. So photomedicine, biostimulation is more effective, low cost, and doesn't have side effects. We see more mucositis clinical research made, and treatment on implants and periodontitis treatments, even to the horse. We have regeneration and fracture healing at the horse. Also high use in sport medicine for football players. We see as well the use of laser versus steroids, and how the formation of the scar is much better and clear with the laser. And one proof is that after using laser so much, it scattered and I didn't have wrinkles, so maybe some stimulation of collagen happened to me as well. Transection spinal cord injury is very easy to use. Imagine, these have effect up to 6 millimeter, and we put it on the spinal cord. And Professor Longo have research when he gathered people, that's his practice in Florence, in Italy. He gets the people up from the wheelchairs, carrozze. Carrozze means wheelchair in Italian, and that's what Diego does as well. Diego Longo have practice in Florence, in Italy. Then we have third molar and endodontic treatment that benefited of the laser therapy. In all cases, we found in the benefit of the patient, because the laser therapy kills bacteria, and also the laser therapy causes this regeneration and stimulation of the bone. So first we have to clean really, really well and kill bacteria, stop bleeding, remove inflammation, and then we do the sessions like in a physiotherapy to regenerate the tissue. I let you read these few pages. As we see, red and infrared, I got to the conclusion, Professor Turner in Sweden got to the conclusion. He had one of the first laser therapy books. Professor Jan Turner and Lars Hode. We have the use in tendinopathy, in articulation, and that was one of the first FDA approval in 2002. And we see how NSAIDs we get to the use that phototherapy is more effective and low cost and doesn't have the side effects. In bite strain and in trismus, in pain relief after temporomandibular disorder, we found in the benefit of temporomandibular joint. For example, patient have bruxism, yes? The mouth is closed, 6 millimeters aperture. We just arrived to do Apex injection. anesthesia by the temporomandibular joint, and we get to do the laser on both sides. Even if this joint is troubled, we use the laser on both sides, and the patient start to open, and we ask the patient to keep doing exercises, and we keep doing the sessions of therapy until the articulation stimulates collagen, gets unblocked. We already get unblocked and starts to practice to stay unblocked, and the cartilage gets regenerated. Peripheral nerve injuries have the benefit of laser therapy. Ankle sprains, anti-inflammatory drugs, in the use of helium neon laser, we found in the benefit of the laser treated group. Neck pain again, chronic arthritis, muscle damage get regenerated with the laser. In a volleyball players that have muscle accidents, injuries. In the knee articulation is so delicate. Imagine the surgery when you cut and it causes all this trouble. So then with the laser therapy, we managed to regenerate at a distance and avoid surgery when is necessary, possible. Remember what happened. The laser therapy does not come as a principal treatment, comes as a adjuvant, as a help to the classical medicine. So we do all the state-of-the-art of treatments that we have in our hands, and then the laser therapy. On the spinal cord, we apply the laser here at the end of on the back, and then from that we get stimulus. We get stimulus on the nerve through the articulation to the circulation, nervous, lymphatic, venous, arterial to the spinal cord. The laser affects up to 6 centimeters into the body, so we have this effect that we get to the spinal cord, that we have this benefit to the paralyzed patient. Also, when it's fracture, non-union fracture get regenerated with the laser. Research is done in London, and even horse fracture. The heart is not far from and is easy to treat. So post myocardial infarction regeneration, it happens with the laser therapy. Recently, Professor Chukwuka and Wemeka, my dear wonderful friend and chief editor of Phototherapy Journal, he made a research where he put the light as a potential treatment of coronavirus. He put the light on the bronchi at a distance, yes, at a distance, and on the lungs to cause this PhotoBioModulation and regeneration. On the bronchi, laser is supposed to kill bacteria and viruses and so on. This is one research that got me the best paper award in Laser Florence in 2002. When, what did we do? We enter on the canal and we irradiate young patients. And we enter on the canal and we irradiated. We clean first really, really well. We clean really well. We use antiseptic irrigation, and then we enter, but not with the surgical laser or hard laser, with the handpiece of the laser therapy. I'll show it to you 1 second. This is the handpiece. This is the handpiece. So with the handpiece, we enter in the canal and we irradiate it infrared. At that time, we had this machine here by Professor Agapita, and now I have this one. This one. One day we'll do a demonstration, and I'll use one that we have now. So inside there are procedures that are already set, or we have made our own protocol based on experience. So that's what we did. We enter on the canal, and then the patient said, close it, I have no time. Busy man, young, with children and with the business, too busy as a man. So we did close it, and then we took a picture. In 8 weeks, we found no more lesion, no more empty space, and also the bone around is better healed. We put a lovely bridge after all, and then we said this is causing this bone regeneration. Other bone regeneration times we found in many of our studies, and then I show you again so you don't forget. There it is, the curve of treatment, and how we cause stimulation when we want to do this photobiomodulation to regenerate, or when we want immediate effect to stop bleeding, stop inflammation, and reduce pain, we use the dose for inhibition. Use continue as a dose to remove pain, and we use pulse Nogier frequency to do regeneration. So in conclusion, what is this photobiomodulation? Reduce bleeding, reduce pain. It helps that we have no post-surgery complication. Inflammation is gone. Formation of cloth. There it is, no alteration of the and no interrupted social life and professional life. And long-term effect, we have a rapid and aesthetic scar, healing of soft tissue, bone tissue, rapid recovery, mastication function. We use it for the buccomaxillofacial region is restored. Patient's results depend on age, general health status, metabolic problems. But in all cases, we found the patients have the benefit of the laser, very good results in diabetics, no recurrence or very low, and no side effects. In 1998, since then, NASA started to use laser therapy for the space room healing. In 1999, US military started to research to do nerve regeneration with LLLT, and in 2002, 2003, Glenn Calderhart sent a general email to everybody saying our days will come. There it is, still we are now in 2022, and this is still new. So here we are to spread the word, and hopefully more and more will be becoming laser therapy user for the benefit of the patient. I'll show you again Isaac Kaplan, Einstein, Neumann, Master, and Tina Caru. and then all the other wonderful laser researcher. Thanks to them, we have this lovely instrument. This is a painting that I made because I have a passion. I am an artist, I am a painter. This is my dad, and this is me when I was little, my dad and mom. Unfortunately, I lost my dad 1 year ago, and I cry every day. My dad, Professor Paul, was a champion athlete and professor, and he gave me a life advice. He said, enjoy life. Profite de la vie. Profite de la vie. Enjoy life. These are the students. We love the students. They're our children. And we are so happy to see them successful. There it is me. You think I'm not an Indian girl? You might be wrong, because here we are in India, in Kerala, Kovalam Beach. And I'm very happy to be in front of you. Thank you so much. Let me show you now one little video that I like. And maybe you will like it. Let's see, let's see, let's see. Let's see. So here we are at the conference in at the graduation ceremony. There you go. And then I show you another one. We in Kerala know the party. I couldn't resist. And then I have another one.
Hello.
My family group and serially.
I created this dancing moment because we were there sitting with all the lecturers, and I created that dance. questions, please shoot. What I didn't mention is the beautiful use of mercury detox with photobiomodulation, because as stimulate the circulation, then the detox will happen with the laser. So please, if you have any question, oh, you didn't see the video at all. Did you see the video? Oh no, oh no. How can I put it in the lecture? I will send it to I'm gonna send it. The video, I will send it by email. Yes, we'll put it on the, there you go, maybe just like this will come. Because it's a wonderful, wonderful, wonderful proof of just good research and so on. So if you see Star Trek, in Star Trek they use photobiomodulation. They did, and they used it, and they didn't know that it truly exists. So let me insert it in the lecture, and there it is. I hope you see it now. Uy. Did you like it?
All of you can unmute and give your feedbacks to Professor. And if you have any doubts, you can directly ask the Professor now. The session is open for discussion.
Let me show you another video. So as you see, oh, am I? No, I'm not. As you see, in Kerala, we dance, we enjoy, we are very serious, and we work and we dance. And when during the International Week of Research at the PMS College, I went in front of the students and I asked them to dance. And then we caused this lovely dancing, and we went by the stage and we danced. At that time, Professor Bernard, who came to do implants from the University of Geneva from Switzerland, he said to me, I don't know you, I don't know what to teach, but I give you a job. If you made 400 students to get up and dance, then whatever you teach, I give you a job. And he did, gave me a job to teach implants and orthodontics, but then I had to decline to New York. So please enjoy the lectures of Asia Association of Laser Therapy. I am so grateful that you invited me. I hope I was useful and I explained easy. If you want to buy a laser, you can just look, you can find cheap ones. I found even $50 lasers. Or you can go and borrow from a friend and use it. You must learn. Nowadays, we have so much learning materials. Now, what I want to say again, don't forget, this is cold, this is non-invasive, you learn the dose, you protect your eyes, you don't put it on thyroid, you make sure there's nothing shiny in the clinic where you use it or in the hospital, in the operatory room, and you can treat at a distance. You measure the distance, you measure the dose, how much joules per centimeter. For photobiomodulation, 1 joule up to 16 joules. You can have continue, you can have pulse. Continue, this is in general. Now more research is to be done, but still it's wonderful that we arrive. When we arrive, it's such a unique, useful little technology that we use. And if you see how Star Trek, they thought it's science fiction, but it's not. It's not. It's just a wonderful instrument. There are so many protocols to use. You will do your own protocols, or you will learn. Each laser comes with a catalog. There are many home use devices that even you can buy and use it in your clinic. The little home use infrared is one from Japan that is 780 nanometers. I don't remember the company. So if you want to begin with, just use just get a really cheap one, actually, one lovely businessman, lawyer in London bought a laser like this from me to use it for his mother. So home use, professional use, doesn't matter. One way to make proof and make my patients, the students, believe that laser therapy work, I asked the whole classroom, which one have the nose stuck? And there is a hand, and we put the laser on the nostril with the anti-inflammatory, and the decongestion happened instantly. Let me show you a few techniques of using laser. So let's say somebody has sinusitis, it's winter, they went in the cold, in New York, outside with the snow and everything. So what they did, we used the laser on the sinus, frontal sinus, and then we used the laser on the lateral. And then in the nose. Yes, let's say we have periodontal disease. As you see, the operation of the laser, it is like a physiotherapy device. It's not invasive and it's sterile. So what you have to be sure that you're not going to use the handpiece from one to another. You can change the sleeve, or you can put the protection and you sterilize it from one patient to another. but it's non-invasive and is at a distance because you don't enter into the bloodstream of the patient. Now, let's say for the temporomandibular joint, you go and follow the pain. Either you ask the patient to do it or you do it. You follow the pain. On the masseter, at the insertion, and on the temporomandibular area. And then how you do for periodontal disease, or if you have bleeding gum, because even if you have a medical practice, sometimes you have patients with bleeding gum. So what you do, you make sure the patient really brush their teeth, you make sure the patient doesn't have debris, tartar, decay, bed restorations, and then with a Q-tip, 1 drop of propolis touching entire mouth. Of course, the use of chlorhexidine, mouthwash and gel, and then you touch, scan entire maxillary area 3 times a week for the first 2 weeks, and then 2 times a week the next 2 weeks, and then each 6 months. This is treatment to treat periodontal disease and cause regeneration. Immediate stop bleeding effect is absolutely immediate. You saw one of the research I did when long time ago, how to stop bleeding. So what did we do? You know what we did? We caused bleeding here and no bleeding here, and we saw bleeding both sides. So one side we used the laser, one side we didn't use the laser, and we saw in both sides the benefit of the laser, and you see formation of the clot immediately.
Sorry to interrupt, Professor. We have a doubt from Dr. Savita. She wants to know, how do you decide on joules for different procedures? Please, can you answer this?
We learn from our experience and from the literature. For example, Tinakaru measure the activation of cells. So she measured on 1 joule on a herpes lesion. So we see how inflammation goes away. So by looking at the literature, whatever other doctors they have done on the past 60 years since laser therapy exists, 55 years, and then we realize ourselves into the practice. What is the dosage to use? 1 joule up to 16 joule, no more than 16 joules a day, because it's scattered. If it's too much, it's not good. It has to be just right.
Thank you, Professor, for answering. Okay, one more question. What was the treatment protocol used for cystic granuloma?
I'm going to go back to the slide. So we had this lovely tooth, right? Everybody would remove this tooth. It's ugly, it's done, we finish with this tooth. But no, patient didn't want it out, and I played a lot. I didn't want it out either. So we enter. This was in 1998 or something. We enter on the canal. We clean the canal with the normal endodontic files at the time. Then we irrigate with antiseptic chlorhexidine, anti-inflammatory, physiologic serum. We irrigate the canal. Yeah. And then we put the laser. We stick the laser inside the canal, 1 joule. Now, because the infrared have this handpiece that goes like that, you saw it at the safety. This an infrared act at a distance. So even if we place the laser here, the action of the infrared laser happened here at 2 centimeters distance, 25 millimeter distance. So we place the laser and then we close it. We close the tooth with, at that time, we use calcium, and then we close the tooth, we put a post and core, and we irradiate it first inside the tooth, right? With the device that goes inside the tooth. And then the most important for periapical, exactly at the apex. We touch, we feel where the apex is, and we touch at the apex. And we make sure we never go on the eye, we go at the apex. Because some teeth, they grow their sinus teeth. And then as we touch at the apex, we did it works very well for male patients that have strong bones and very clear apical lesions, and it works very well in frontal teeth. Also, it works very well on teeth with 3 roots as well. So in that, we do the same. The benefit of infrared is at a distance, so we don't need to cut or do this curettage. I never did curettage, actually. I didn't need to because I had the laser. Also, did you see? I went to Vienna and visited the dental museum. All the instruments that we have now, forceps, bends, excavator, elevator, curette, they're invented in 1800s. Why not we evolve and use the lasers? We have several types of lasers. I use a lot the laser, surgical laser too, and that makes beautiful sterilization and regeneration. Why? Because even the surgical laser on the area, they have this photobiomodulation at the edge of the action of the laser.
Thank you, Professor. One more repetition for treatment of bruxism again.
Bruxism. The
Yes.
bruxism, you use with 4 joules per session into the temporomandibular joint. Yes? Bruxism. You remove the factors of stress in the life of the poor patient, and also you can give a night guard so that it keeps the articulation at the distance at night and during the day, so the cartilage have time to regenerate. As well, have to do about 10 sessions of laser therapy in the temporomandibular articulation so that the cartilage have the chance to regenerate, because what happened in bruxism, the cartilage got down. Also, make sure that the patient got the ideal occlusion with the entire maxillaries in good order.
Arch, the entire maxillary and mandibular arch alignment is what you meant?
Yes, and with the laser therapy, it acts in non-invasive way in the articulation and causes this regeneration of cartilage, and then it makes the cartilage is regenerated. It makes the distance, and then bruxism doesn't happen. When is a trismus, when the patient live with the mouth blocked, then you do an injection like at the spix for the alveolar maxillary inferior and alveolar inferior nerve, and at that time you take advantage of the moment and you ask the patient to open the mouth, and use the laser outside the mouth and inside, so you have action on the articulation on this side and on that side to cause this, because laser causes pain relief. So then it sees, it doesn't feel, and out of a sudden gets unblocked. Also, it's very good, you know, when you have these salivary glands blocked sometime and you have stomatitis and you don't know what happened, you get to get pineapple juice. You ask the patient to get pineapple juice because that unblock the salivary glands. And then laser therapy around the mucosis and causes regeneration, flux of circulation, and the salivary glands hopefully unblocked. Is not doesn't exist a magic solution to anything. Laser is a help to the traditional classical treatments. A wonderful, wonderful help that does makes our life easy.
Thank you so much, Professor. And to answer Deepa Shetty ma'am, you'll have one more session on this when we take lasers and endodontics by Dr. Madhu Hariharan sir himself. And you don't have to worry a lot about it. And for the jewels for different procedures will also be dealt when multi-wavelength strategies that can be used. And thank you, Professor. Any more questions you can ask or shoot in the chat box, Dr. Or you can unmute yourself for and ask Dr. Professor.
When we do the bruxism, it's not one session, 10 sessions. We do 10 sessions. That's what we do in our practice. But each, you know how the Indian kitchen is one way. I don't know to make curry. I wish I do. The French kitchen is one way. So each practice have their own kitchen for the treatments. And so if you have more questions, please send them to the association and we'll answer them to you. To the Asian Association for Laser Therapy. Thank you so much for having me. This is wonderful. And we'll put it on YouTube, this lovely lecture, so you can see it again. Thank you, Dr. Ashu.
Thank you so much, Professor. It was a great pleasure to have you on Asian Academy of Laser Therapy, and it takes me immense pleasure that I had the privilege to welcome you on this platform and to have heard you. And I hope all of the participants are also very happy with the lecture. And thank you so much for taking your precious time away, getting up early in the morning. That I know this is 6:30 or 7 in New York, and it takes a lot of effort to get up so early. Attend class. Thank you so much.
Namaskaram.
Namaskaram. It's a pleasure. And on behalf of Dr. Madhu Hariharan sir, Dr. Chandrasekhar Yavagal sir, and my colleague and our senior coordinator, Dr. Baswant Reddy, we have had a very good session with you, and it was a pleasure. Thank you so much, Professor.
Thank you all. Thank you, Laser Therapy Asia Association.
Thank you.
Bye-bye.
Bye.